Is fibromyalgia a real thing? Hmm. To be honest, I'm not really sure, but I know that the chronic pain I experience every day is a very real thing, and the chronic pain other people experience every day is also a very real thing. I started having a lot of chronic pain out of nowhere about 7 years ago, and with the pain came a loss in my flexibility and also some numbness. I've been diagnosed with a few different conditions by different medical doctors. The first rheumatologist I saw said that I had enteropathic arthritis, which can be a symptom of ulcerative colitis, which is another super fun condition that I have that I developed about 10 years ago. Thank God I am in remission and have been in remission since the end of 2021 because I was in a really bad flare for most of that year and it was very debilitating. And it is just a shitty disease to have to deal with. No pun intended. I also saw a naturopathic doctor who diagnosed me with chronic Lyme disease, which I am also not really sure if that's a real condition. I know acute Lyme disease is definitely a real thing, but chronic Lyme disease seems to be one of those things, like fibromyalgia, where they don't know how to treat it and they may prescribe it when you have idiopathic symptoms, meaning doctors do not know what is exactly causing your symptoms. So I saw another rheumatologist and they had diagnosed me with fibromyalgia. I inquired, is there anything that can be done to alleviate these symptoms? And they seem to have no clue. So the only thing that helps with my chronic pain currently is the use of red kratom, which I've been taking for a few years. It just masks the pain and is only a temporary solution. Doesn't address the root cause, but it's better than nothing. And if you'd like to learn more about red kratom, I do have a couple other videos that I made about kratom. Recently, my GI doctor had persuaded me to see another rheumatologist, which I knew would be a waste of time, and it was. They wanted me to do physical therapy, specifically Aqua therapy, so floating around in a pool. And I'm just thinking, really? Are you kidding me? This is what you're telling me to do? How is this going to help me with my pain? I think it would be beneficial for somebody who's not physically active at all, who has a lot of trouble moving around, who really doesn't exercise or do really any type of physical activity. I think for them, floating around a pool, moving a little bit, could definitely be beneficial. But not for somebody like me who lifts weights pretty intensely, who grapples pretty hard with full-grown men and does a lot of other, what I'd consider pretty intense exercise. Floating around in a pool is not going to give me any additional benefit. I'm sorry, but it's not. These medical doctors, they don't know how to think outside the box at all. They tend to prescribe the same treatments for everybody, and they can't go by a patient-by-patient, basis. I don't understand how they can't do that. Like, is it that they are idiots, or is it that they don't care about their patients? I feel like it could be a combination of both, and I'm leaning more towards the latter. The experience reminded me of a time when I went to see a physical therapist, and I was there for low back pain issues, which never really got resolved. And the guy had me lifting 3-pound dumbbells. I'm thinking, dude, really? I bench press 300 pounds for reps. What is this going to do for me? And it did absolutely nothing, so I stopped going. It was just the biggest waste of time, and the guy was definitely incompetent, like most medical professionals I met. I just want to make it clear that I am not saying fibromyalgia isn't a real condition. I do tell people that I have it. I'm just not positive if that is what's really causing my pain. I wish I knew if that was the root cause of the pain, or if it was something else at play. To me, it just seems kind of like fibromyalgia and chronic Lyme disease are something that medical doctors prescribe, or excuse me, that they diagnose you with when they don't really know what else is going on. So, if fibromyalgia is the root cause of my pain, it would be nice to know if there was something that could be done to address it. If you've been diagnosed with fibromyalgia, how'd you go about dealing with it? Have you found anything that seems to help alleviate your symptoms? Do you have any other symptoms besides chronic pain? Because I know people can have other symptoms besides that. Does it impact your life in a significant way? I still try to stay physically active, but having these issues definitely makes it a lot tougher. I just know that if I'm sitting there for a long time, my pain will actually get worse. So that is one of the many reasons why I choose to stay physically active. Let me know what your thoughts are about this. I'd love to hear it. So, until next time, stay strong, warriors.